Hi everyone. This is the first section of my posterior thigh and popliteal fossa lecture. In this first part of this lecture, I will talk about the bones related with the muscles of the posterior thigh, and also I will talk about the knee joint. Already I described about the proximal end of the femur. Here is the shaft of the femur. On the posterior aspect of the shaft of the femur, there is a longitudinal ridge or line which we call the linea aspera. Linea aspera gives attachment to the most of the muscles of the adductor group or the medial compartment muscles of the thigh. The linea aspera inferiorly, it is divided into two supracondylar lines. The medial supracondylar line and lateral supracondylar line. This extends inferiorly. The medial supracondylar line goes up to the medial condyle of the femur, and the lateral supracondylar line, it extends up to the lateral condyle of the femur. And in between this medial and lateral supracondylar line, this triangular surface on the posterior aspect of the distal end of the femur is smooth. Excuse me. And this smooth triangular surface on the posterior aspect of the distal end of the femur is called popliteal surface. And this popliteal surface forms the floor of the popliteal fossa. And inferiorly, this medial and lateral condyle, these are the two large condyles of the femur. When we in anatomical position, these two condyles lie in the same horizontal plane. So if the two condyles lie in the same horizontal plane, then see the shaft of the femur is oblique. This is the anatomical position of the femur. Shaft of the femur is oblique. The obliquity of the femur is more in case of female because the female pelvis is much wider than the male pelvis. And this medial and lateral condyle of the femur, in between these two condyles, there is an intercondylar fossa. And this condyle has a smooth articular surface, and the smooth articular surface of the medial and lateral condyle of the femur, these articulates with the articular surface of the condyles of the tibia. The tibia and fibula are the bones of the leg. Tibia is the medial bone of the leg. It is much stronger than the fibula. Tibia transmits the body weight from the femur to the tarsal bone inferiorly. And also tibia participates in the formation of the knee joint. Fibula doesn't transmit any body weight, or it doesn't participate in the formation of the knee joint. Fibula only provides the surface area for the muscle attachments of the leg muscle. The proximal end of the tibia has medial and lateral condyle, which articulates with the condyles of the femur and form the femorocondylar joint in between the femur and the tibia. And in between the medial and lateral condyle of the tibia, this area in between these two condyles is called intercondylar eminence. The fibula is the long, slender bone. It is the lateral bone of the leg. It has a proximal end, shaft, and distal end. The proximal end of the fibula has a head and a neck. Neck is the junction of the head and the shaft of the fibula. And the pointed upper end of the head of the fibula is called the apex of the fibula. The knee joint is our largest superficial joint of our body. It carries our body weight during standing and walking and running. And the knee joint is a hinge type of synovial joint. It's allowing only the flexion and extension movement. The knee joint is formed by the condyles of the femur and the tibia. And in between the femur and tibia, there are two femorotibial articulation, which are the in between medial and lateral condyles. The medial condyle of the femur articulates with the medial condyles of the tibia. So there are two femorotibial articulations, and anteriorly there is femoropatellar articulation. The patella is a sesamoid bone which lies within the tendon of the quadriceps femoris muscle. Quadriceps femoris muscle is one of the muscles of the anterior compartment of the thigh. And patella articulates with the intercondylar area in between the medial and lateral condyle of the femur, and it forms the femoropatellar articulation. Like the other synovial joint, the knee joint has a joint capsule. The joint capsule of the knee joint has a fibrous capsule, and the fibrous capsule is internally lined by the synovial membrane. This red line, it indicates the synovial membrane, and inside the synovial membrane there is synovial cavity which contains the synovial fluid. These are the characteristics of the synovial joint. The patella lies anterior to the condyle of the femur, and the tendon of the quadriceps femoris muscle is attached to the base of the patella superiorly. And then from the apex of the patella, the tendon of the quadriceps femoris muscle extends inferiorly as the patellar ligament, and that is attached to the tibial tuberosity, which is a bony prominence on the anterior aspect of the proximal end of the tibia. So the tendon of the quadriceps femoris, the patella, and the patellar ligament, this forms the anterior part of the joint capsule. This replaces actually the anterior part of the joint capsule of the knee joint. And posteriorly, you can see the joint capsule, the fibrous capsule is attached posteriorly, superiorly to the margin of the condyles of the femur, and then inferiorly it is attached to the margins of the condyle of the tibia. Deep to the tendon of the quadriceps femoris muscle, superior to the patella, there is a suprapatellar bursa. In between the tendon and the distal end of the femur, the suprapatellar bursa, it extends superiorly deep to the quadriceps femoris tendon, approximately 5 cm above the patella. And inferior to the patella, there is a pad of fat, which is called infrapatellar fat pad, that is lined by the synovial membrane. So in this illustration, you can see the infrapatellar pad is covered by the synovial membrane. This is the anterior view of the knee joint, and the patella is reflected inferiorly. So you can see at the inferior aspect of the patella, the infrapatellar pad of fat, which is covered by the synovial membrane. This red line indicates the synovial membrane inside the joint capsule. And see, from the infrapatellar pad of fat, there is a thin fold of synovial membrane, which we call infrapatellar synovial fold, that extends from the infrapatellar pad of fat into the middle of in between the two condyles of the lateral and medial condyle of the femur. And this infrapatellar synovial fold, it divides the knee joint cavity into lateral and medial parts, into two parts. So this is the fibrous capsule, and internally it is lined by the synovial membrane. The joint capsule or the fibrous capsule of the knee joint is reinforced by the ligaments. The important extracapsular ligaments of the knee joint are the tibial collateral ligament, medially, and laterally fibular collateral ligament. And also there are some small ligaments, those are not very important, the oblique popliteal ligament and arcuate popliteal ligament. The tibial collateral ligament is also called medial collateral ligament. It extends from the medial epicondyle of the femur, and then it goes inferiorly, and inferiorly it is attached to the medial side of the medial condyle of the tibia. The tibial collateral ligament or medial collateral ligament is firmly attached with the medial meniscus, approximately in its middle part. So medial meniscus is attached with the medial collateral ligament or the tibial collateral ligament. And the fibular collateral ligament extends from the lateral epicondyle of the femur, and then it goes inferiorly and it is attached to the head of the fibula. But the fibular collateral ligament is not attached in its deeper aspect to the lateral meniscus. the tendon of the popliteus muscle. See, this is the popliteus muscle, one of the muscle of the posterior compartment of the leg. The popliteus muscle tendon is passing through the capsule of the knee joint, and this tendon of the popliteus muscle, it separates the fibular collateral ligament from the lateral meniscus. Here you can see the fibular collateral ligament, which is also called lateral collateral ligament. It is separated from the lateral meniscus by the tendon of the popliteus muscle. So the tibial collateral ligament and fibular collateral ligaments, these are the collateral ligaments. Because of the firm attachment of the medial meniscus with the tibial collateral ligament, these two structures are commonly torn during contact sports, such as football or ice hockey. And also the medial collateral ligament or tibial collateral ligament is weaker and more commonly ruptured than the fibular collateral ligament. Fibular collateral ligament is stronger. There are intra-articular ligaments. The intra-articular ligament includes the cruciate ligaments, anterior and posterior cruciate ligaments, and also the meniscus, the medial meniscus and lateral meniscus. The cruciate ligaments, there are two cruciate ligaments, anterior and posterior cruciate ligaments. They connect the distal end of the femur with the proximal end of the tibia, and they are positioned. They form a crisscross like the letter X. That's why we call them cruciate ligament. The anterior cruciate ligament is weaker than the posterior cruciate ligament. It is attached inferiorly to the anterior intercondylar area of the tibia. You can see here, this is the attachment of the anterior cruciate ligament. This is the superior view of the articular surface of the proximal end of the tibia. So anterior cruciate ligament is attached to the anterior intercondylar area of the tibia, and then it goes obliquely and superiorly and laterally, and it is attached to the medial side of the lateral condyle of the femur. The posterior cruciate ligament, it extends from the posterior intercondylar area, and the posterior cruciate ligament is attached superiorly on the lateral side of the medial condyle of the femur. Posterior cruciate ligament is stronger than the anterior cruciate ligament, and this cruciate ligament, it forms the connection between the femur and the tibia. The anterior cruciate ligament, it prevents the hyperextension of the knee joint, and also it prevents the posterior displacement of the femur over the tibia. And the posterior cruciate ligament, it prevents the anterior displacement of the femur from the tibia. The anterior cruciate ligament is more commonly ruptured than the posterior cruciate ligament, because I mentioned that it is weaker than the posterior cruciate ligaments. When we walking downhill, then the posterior cruciate ligament is one of the major factor which gives the stability to the knee joint. When we walking downhill, the weight-bearing knee joint, the posterior cruciate ligament is an important factor for the stabilization of the knee joint. The meniscus are fibrocartilaginous wafers over the condyles of the tibia. There is medial meniscus and the lateral meniscus. The medial meniscus is larger and C-shaped, and these meniscus, they deepens the articular surface area of the tibia, and also this meniscus acts as a shock absorber. The medial meniscus is attached anteriorly to the anterior intercondylar area, anterior to the anterior cruciate ligament, and posteriorly it is attached to the posterior intercondylar area. And already I mentioned that medial meniscus is firmly attached with the tibial collateral ligament. The lateral meniscus is smaller and circular in shape, and lateral meniscus is not attached to the fibular collateral ligament and the tendon of the popliteus muscle that separates the fibular collateral ligament from the lateral meniscus. The major movements of the knee joint are the flexion and the extension. The flexion of the knee joint is the main muscles producing the flexion of the knee joint are the hamstring muscles. The hamstring muscles are the muscles of the posterior compartment of the thigh, and these are the flexors of the knee joint. And the extension of the knee joint is produced by mainly the muscles of the anterior compartment of the thigh, and the quadriceps femoris is the main muscle which produces the extension of the knee joint. There is a little bit of medial and lateral rotation of the knee joint occurs, but that is very, very small movements. Major movement is the flexion and extension. And quadriceps femoris is one of the main major muscle which gives stability to the knee joint. Knee joint injuries are very common. Knee joint injuries are very common because knee joint is most mobile weight-bearing joint. The knee joint is essential for everyday activities such as standing, walking, and climbing stairs. It is also a main joint for sports that involve running, jumping, kicking, and changing directions. To perform these activities, the knee joint must be mobile. However, this mobility makes it susceptible to injuries. The most common knee injuries in contact sports are ligament sprains. And the tibial and fibular collateral ligaments are the most commonly torn ligaments. The firm attachment of the tibial collateral ligament to the medial meniscus is clinically significant because tearing of this ligament frequently results in concomitant tearing of the medial meniscus. So the tibial collateral ligament and concomitantly tears of the medial meniscus from the joint capsule. This injury is very common in athletes who twist their flexed knee while running, for example, in basketball or various forms of football and volleyball. So the tibial collateral ligament, medial meniscus, these two structures are commonly injured in contact sports, and also sometimes these two structures and also the anterior cruciate ligament rupture is occurred together. So if there is the rupture of tibial collateral ligament, medial meniscus, and anterior cruciate ligament rupture occurs in the same time, it is called unhappy triad. It is very, very painful, and it is called unhappy triad. The anterior cruciate ligament rupture is also common, and during anterior cruciate ligament rupture, the tibia slides anteriorly from the femur, from the distal end of the femur, and you can pull the tibia anteriorly like the opening of a drawer, and that is called the anterior drawer sign. Anterior drawer sign is one of the signs to diagnose the ACL rupture. And during PCL rupture, the posterior cruciate ligament rupture, the tibia slides posteriorly like you are closing the drawer, and that is called posterior drawer sign. And posterior drawer sign is occur during PCL rupture, and these are the common knee injuries. Thank you. This is the end of my first section of the posterior thigh lecture. So in my second section, I will talk about the muscles of the posterior compartment of the thigh and the popliteal fossa, the boundaries and contents of the popliteal fossa. Thanks.